This conference will now be recorded.
Good afternoon, everybody. Thank you for joining us for our Allscripts training today. Today we are going to go through our assessment and plan, part one of our assessment and plan training. So we are going to launch our cloud login. We're going to log into the cloud here, launch our Mountain folder, click on our clinical module, and that will prompt our green screen for login. We're going to put our username and password here. And it's going to connect us here to our application. So I want to go over a couple of things with everybody so that before we jump into the assessment and plan. The first thing that I want to do is if we launch our patient, click on our search training patients and hit search. When I double click my patient and launch my patient's chart here, I have my encounters that we have open. And we talked a little bit about this in our training for our physical exam templates, making sure that we have our templates, we have no more than 5 encounters open, or we wouldn't be able to launch a new one. That's important to us right now because we're building our physical exam templates for our providers and making sure that we can create as many as we need, and that we don't max out our encounter usage. But this is really important to us when we go live with Allscripts, because this will allow us to keep track of the encounters that we've signed off on, or the ones that we have open and we don't have any content in. So if we were to open a patient's chart, but we didn't close it while we were looking up the last chart note, or we were referencing to see if we had received their op report, or maybe we had looked to see if we had received their lab results yet, but didn't actually create content in the chart, it would still stay open right here. And so we can, what we can do is if we haven't entered anything in the contact part of the patient's chart, we can close that up. I'll show you what that looks like if we go into our encounter from yesterday that we created, our 413. If I click OK, it launches my patient's chart. Again, if I haven't entered any information down here in the contact portion that's unique to this patient encounter, then I would be able to close it by just clicking my orange button, refiling that chart into the files if we are referring to our paper chart example that we've been referring to with these buttons. If we wanted to see if we had anything built, we could go to our history and physical link here. We can see that we don't have any information here. So we could go ahead, file it away, and we've closed that encounter. So now if I look up my test patient again, make sure my search training patients box is clicked and I hit search, relaunch my test patient, you can see my 413 visit is no longer here. It's no longer open. Another thing that we could do, another way we could reference that same tracking, although our encounter selection pop-ups are great as we are looking up patient by patient. But if we have a bunch of patients open and we're not closing them as we go, we can reference those that we still have open. If we look to our right margin here in our desktop screen, we have our appointments here. And if we click on our inboxes, we click appointments, you'll recognize the screen, the same that's behind us of our, it's our appointment screen for that location, for that day, for that physician that we've defaulted to. So that's a quick reference. To close that up, we can use our double caret and close that up. For our open encounters, right below that is our open encounters. We can click on that, and you'll see that I have 4 open encounters listed here. This one from 410 that we had opened on that visit when we had our encounter selection pop-up screen come up, it's listed right here. And we could open the chart by clicking open here. We could go to our history and physical. We could see that we have something in here, and so we would need to sign off on it. If we try to, I'm gonna move to our face sheet. So if we try to close this by clicking our file chart, you'll see that it does not close and go to our desktop view. It takes us to our history and physical screen here, where it's prompting us to use our sign off in order to close this encounter, because we have populated information down here in the our contact screen. You'll notice in our right margin, we have the same selection options that we have from our desktop screen. And so again, we could click our appointments and see what our appointment list is for quick reference. It does keep our patient's chart open in the back, so we could close our double carets here and then still be able to reference our patient information if we wanted to see the status of our patient appointments that are upcoming. We could use this as a reference. And we can also go to our open encounters here, and we can see that we have open encounters here as well, and we could launch it from here by double clicking or clicking our open if we wanted to close those encounters. So just something to be aware of. We talked about that encounter selection screen yesterday, wanted to give us another vantage point of how we can manage those open encounters here on the right margin, and then speak to why that would be important, not only for today as we're building our physical exam, but why it's even more important that we pay attention to that screen as we start using this application in our individual divisions as we go live. So I'm going to go back to our face sheet here. As a reminder, we went through our workflow yesterday. What have we learned? And took us from our demographics to our patient intake and then our physical exam. Here at our physical exam, we can populate the information here. We could also go to our clipboard with our lightning bolt here. Reviewing this screen, we did go through this quickly yesterday. Want to make sure that everybody recognizes this screen. Here down at the bottom, the left bottom column here, this information is specific to this patient's chart. So this is patient-specific information. And up here on the top left, you'll see that these are these are our template folders that are available for us to use in all of our patients. And so you can see that there's a lot of providers that have been very busy creating their physical exam templates. So thank you guys for that. And you'll see that list will get longer and longer as people continue to save templates there. My templates, which is the name of this folder, your templates, the ones that you've saved individually, will always go to the top for quick reference and will default by being expanded. So that view will be helpful for you as you apply the templates or you're looking for something specific versus having to find your name alphabetically here. If after your templates, your default templates that you've built under the My Templates folder, then you do have access to all of the other users' templates that have been built in alphabetical order here. So as a reminder, if we want to save a template, we can click on the template in our patient visit here. We can see that we have all of the information listed here. If you've gone through the history and physical and the review of systems, patient's past medical history, then it will not populate here. If the visit that we're currently on already has a physical exam populated on it, you'll see that this is all grayed out, so I'm not able to apply this specific template here. And so in order to do that, I would need to open a new encounter. That's why it's important that we keep track of those encounters and that it's one encounter per diagnosis. So in order to save our templates, we can click over here. We could use our Save as Template. It prompts us for what we want to name it. You can click OK. It moves it up here to My Template. If we want to remove something, we can certainly remove it by clicking on it and then using our X here, which would remove it from our template. If we want to rename it, we could also click on it, hit rename, and then our screen to rename will populate for us. Click OK, and then you'll see that it changes the name in our template folder here. If you have a template that you are building now and that you want to use later, and you move it up here, then you use it later, you decide that there are some enhancements that you want to make. Once you have signed off on it, you can go through the same process by clicking on it. You could save it as a template. You could delete your old one. You could maybe identify a correction for it. You can see an example that I had here that I put the date on it for today, identifying that I had made changes for today. And then you could delete your previous template so that you would have the most up-to-date template available. All right, so we're going to discuss our assessment and plan. This is our first training of few. The assessment and plan is essentially our super bill. It's the way that we track what was done in the visit outside of the physical exam, and then adds all of the things that we've done here under current plans. That is all pushed to our billing department, as well as documents it into the patient's chart. So here in assessment and plan, we did talk through this yesterday, but under assessment and plan, if we go to our search, we can search for our diagnosis. I'm going to remove the diagnosis that we put in there yesterday. So we're going to search for our rotator cuff tear diagnosis. We're going to take the generic one, move it down to our current plan. We can double click on that. We can get more specific by going to the pencil and choosing the specific criteria to get us the most specific diagnosis available. We're going to click OK. We're going to click OK here, and you'll see that it changes that down to our current plans. As we start going through the process of our patients, we're going to go to our short list. We've created some of the short lists here. We have several other of the specialties and extremities in production right now, but we're going to start with our upper extremity so that we can see what that looks like. If we find our the specialty that we see most often, we could click on it and send it to my short lists by clicking Add to my short list. It will then move it over to my short lists, and we can go through the process there. If you see a lot of upper extremity, lower extremity, maybe see some foot and ankle and you wanted to work from the short list directly, you're more than welcome to do that. But we're going to go through the process through my short list. So here I've moved over our upper extremity short list. We have the MIPS folder here. That we'll have separate training on that, so I'm going to skip that today and go directly to our X-ray. Our X-rays are, I know, oftentimes ordered by our staff, by our clinic staff, or maybe our PAs, our medical assistants, our nurses, and so they could come in here and do and order an X-ray. You do that by double-clicking. It moves it into our current plans. If I notice that I did an X-ray with the left, however, I'm doing a rotator cuff, I just clicked my X and then I can remove it from my current plans and double click on it and then move over the correct order. If I double click here, I can launch our comments. We do have a a max character. Of 240 in this in our comment section right here. We could use our A to A if we had some items that we wanted to, if there was something that we put into our X-ray findings all the time, we could do that and then drop it in. Again, if we did that, we would click our arrow. I would drop in my AP X-ray findings rotator cuff, and here I would have a comment. Again, that's 240 characters limit. Click OK, and you'll see that it adds that to my X-ray. To close the X-ray portion of this, we're going to click our caret right next to the folder, and it minimizes that folder again. We can go to our injections. Our first subfolder here is our injection code. And so we have a list of our injection codes that we've received from our billing teams. We have our major joint here. We have our interim joint here. And we have our small joint as our third option here. We also have additional injections that are listed, as well as our ultrasound guided injection codes listed as well that you can choose from. If I did a shoulder injection, I would do my shoulder injection and double click on it. And it moves it down here to the bottom. To minimize my injection codes, I'm going to click the caret and then go into my medication. If I was doing a shoulder injection of 2, 2, and 2, I could do dexamethasone and double click on dexamethasone. I could go to my lidocaine and double click on that. And I have a note to include our marcaine, as we noticed that was omitted from the build from our morning session. So I'll make sure that we get that added, but you could double click on the marcaine as well. If we did 2 cc's of each of these, we would go down to our current plan. We would double click our dexamethasone. We would change our units to 2. Click OK. You can see that after we do that, our units change here. We would take our lidocaine, double click on it, also change that to 2. Click OK, and again, it adds the 2 units here. So if we're done with our medications, we're going to use our caret to minimize that. Underneath our steroid medications, we have our injectable series folder. The injectable series folder will include any of our injectables that we do that we either order specifically for the patient or we keep on the shelf for viscosupplementation, Xiaflex, or anything like that that we use, we order for the patient. There's a prescription associated with it, or we order it and we have something on the shelf that we can take down, and there would be a series injection. Will be listed in our injectable series folders. Here in our in-office procedures, we have a list of the procedures that we might do in an office, including our EMGs. We have the biopsies that we could choose from. We have some drainage here. And we have fracture care, if you chose to do a fracture care versus doing an office visit and then follow-up visit charges. So you could choose the appropriate fracture care code. We would double click on it and then move it down to our current plans. I'm going to remove that for our example here, but wanted to show you what that looked like. Since we're done with our fracture care, I'm going to minimize that folder back up here. I'm going to go to our prescriptions. If I click on our prescriptions, there are pre-populated prescription or common medications that Allscripts has built for prescriptions that they anticipate that we might use. You can click that by clicking the caret and seeing under each folder what is available. You might find that this is really useful, or you might find that it's difficult to navigate and try to find where Allscripts has identified where things should be categorized. If you decided that you didn't want to use this drop-down folder option, or if something was listed here that you couldn't, that there was something that you were looking to prescribe that wasn't listed in one of our options here, we could always use our search function. I'll show you how to use that in just a moment. So for here, we're going to go, if we wanted to use it from our folders, we would click our caret, expand our choices. We would then double click our prescription. It would launch our screen to put in our SIG and our prescription specific information. We would enter that information here. We could put any specific information that we needed the pharmacist to see. If you'll remember, when we put our pharmacy information in, we had that icon that indicated that the pharmacy accepted e-prescribing. So when we sent this prescription over, the pharmacist could see our notes. If we wanted to use our tabs up here, we would have some education. This education could be printed, sent to the patient's portal, or given to the patient by printing it for their reference for their education for this medication. This is populated by Allscripts directly. This is not something that we've generated, so this is information that comes directly from Allscripts. And the same thing that they would get from their pharmacist when they pick up their prescription. We have a quick reference here for our patient allergies to identify if what we're prescribing is of concern with the patient's reported allergies. And then there's also alternative options that are listed here. This would be important in case patient's insurance maybe denies the prescription and we need to give them an alternative. This is a good reference for that as well. So under our prescription, once I filled out all the information, we do want to recognize the interactions and share that with the patient if appropriate, and then we can click OK. And in doing so, you'll see that it goes down to our current plans. If there was a medication that was that we wanted again that wasn't listed here, or not easily identified in our subfolders here, just like we went for our diagnosis, we could go to our search. We're going to change our source here to medication. We would then put in our medication name, click search, and our options would be provided for us. And if we double click that, it comes to the bottom. Our prescription screen then populates for us so that we can add the additional information in there. You'll see that we have the same options of education, patient allergies, and alternatives. And you'll see also on the right column here, we have a summary of the patient's information as well as their allergies listed here for reference. We could click OK, and then it would fall to the bottom. In this example, I'm going to click cancel here. If there were other items in our short list that we weren't able to find in our short list, we could use our search functionality for that as well. We would just come here, go to our source, and make sure that the category that we're looking for is listed here and chosen, so that we would provide the we would get the correct search results as we went through our process. So here we are on the short list. I'm going to collapse everything. I'll show you where we've come through. We're going to do MIPS on a different training. We've done X-ray, injection, our in-office procedures, and prescriptions. Tomorrow we're going to go through our DME and CAS, our labs and PT orders, and we should be able to get through our imaging orders as well in our training tomorrow. So join us again for tomorrow's training at 8 or 3 p.m. We do have some questions in our chat that I would like to address before the end of our time here. It says, if you inject multiple small joints, can you select the order multiple times? The answer is yes. If you did that with the same diagnosis, you would put it under the same diagnosis here. You could double click it here, and you could change the quantity. You could put a note in here that indicated the multiple injection site, and click OK, and you'll see that it's listed here. If it was a different diagnosis, you would choose that diagnosis. Under diagnoses, you would add the shoulder pain diagnosis. It would move down to the bottom, and then you could go to your short list, go to your injection, make sure that your shoulder diagnosis is highlighted, and then when you move your injection code, you double click on it, it will move under your additional diagnosis. Another question we have is, can we add custom X-ray order sets, like specific views? Also, can we build one-click injection order sets that simultaneously add procedure note to plan? So the answer is for the X-ray orders, it will be customized by body part, by anatomy, for you to use your X-ray option for that. Although we won't have order sets created, so you would have to, if you had a regular order set, that you would do a 2-view hand and 2-view wrist X-ray, for example. When evaluating a certain diagnosis, you would have to order both of those, or your clinic staff would have to order both of those into the current plan. And then adding a one-click injection order set. Unfortunately, we don't have that ability under this current system, although we're hoping for an enhancement in the system that we can build that, because that would certainly be helpful, and something that we've talked to Allscripts about already. So thank you for that question. Another question is, 1 unit of Celestone is 6 milligrams. How do I change that? So the quantity will be built in already on the back end of the system, so you won't have to change the 6 milligram piece of it. You would just identify that it would be 1 unit that would need to be billed for, and then you would make sure that your documentation was appropriate of the amount of medication that you injected into the patient's joint. So I think that that's the questions that we have that are already registered in our chat. I'm going to stay online in our chat for about 7 more minutes until 3:40 and answer any additional questions that might come up. So please join me there and ask any questions that you might have. Join me tomorrow so that we can continue through our assessment and plan workflow. And I will see you tomorrow at either 8 or 3. Thank you.